My name is Layla Salad, and I'm going to be talking about diabetes through the lens of Western and Tibetan medicine. Yeah. Okay, so on my agenda today, I'm going to do a brief overview, and then I'm going to go over Western medicine applications, and then the Tibetan medicine applications. Okay, so for my general overview, I'm just going to talk about the types of diabetes, symptoms and long-term complications, global burden along with its mortality and complications. Okay, diabetes is a chronic disease that occurs when the body either does not produce enough insulin or cannot effectively use the insulin it produces. Insulin is the hormone responsible for regulating blood glucose levels. Uncontrolled diabetes leads to hyperglycemia or high blood sugar, which can damage blood vessels, nerves, and major organs over time. Type 1 diabetes is caused by little or no insulin production and requires lifelong insulin therapy, which often begins in childhood or adolescence. Type 2 diabetes occurs when the body becomes resistant to insulin or cannot use it effectively, but is often preventable through lifestyle modifications. And this accounts for more than 95% of diabetes cases. There's also gestational diabetes, which occurs during pregnancy and can increase the risk of pregnancy complications. It also poses future risks for type 2 diabetes for both the mother and the child. There's also prediabetes, which can include either impaired glucose tolerance or impaired fasting glycemia. Both conditions place individuals at high risk for developing type 2 diabetes. Some symptoms that people with diabetes have is excessive thirst, frequent urination, blurred vision, fatigue, and unintentional weight loss. And they can appear suddenly in type 1 diabetes, but often develop gradually and may go unnoticed for years in type 2 diabetes. Some long-term complications include cardiovascular diseases such as heart attack and stroke, kidney failure, neuropathy, vision loss and blindness, poor circulation, and foot ulcers, which can eventually lead to lower limb amputation if not treated properly. These typically occur when diabetes have been chronically uncontrolled. The number of people living with diabetes has increased drastically over the past 30 years, going from 200 million in 1990 to 830 million people in 2022. This is a 315% increase globally, which is kind of a problem, and a 7% increase in the known number of adults worldwide, going from 14% of adults living with diabetes known in going from 7% of adults known in 1990 to the now 14% worldwide, which is, I think, about 1 in 9 adults. The prevalence has risen more rapidly in low and middle income countries, as more than half of the adults are not receiving medication due to having the lowest treatment coverage. In 2021, diabetes directly caused 1.6 million deaths. Nearly 46% of diabetes-related deaths occurred before the age of 70. And diabetes has also contributed to 530,000 deaths from kidney disease, and approximately 11% of cardiovascular deaths are related to high blood glucose. In Western medicine, diabetes is understood as a chronic metabolic disease caused by problems with insulin production, insulin function, or both, like I stated earlier. In type 1 diabetes, the autoimmune destruction of insulin-producing pancreatic beta cells, and in type 2, the insulin resistance combined with impaired insulin secretion. Their management and treatment include blood glucose monitoring and A1C testing, which are essential for monitoring and testing both glucose and hemoglobin for long-term glucose control. With technological advances, CGMs are improving every day, with the Dexcom G7 most recently being updated in 2025 to extend the wear time to 15 days for adults. Medications such as metformin, GLP-1 receptor agonists, and SGLT2 inhibitors, as well as insulin, are most commonly used, with the three shown there most commonly used for type 2 diabetics. Some other management can include different prevention and treatment of complications. Lifestyle management is the foundation of treatment, with some key recommendations including a healthy diet, weight management, regular physical activity, and smoking cessation. These are typically the most effective prevention strategies for type 2 diabetics. Some additional prevention measures are blood pressure and cholesterol control and routine eye, kidney, and foot screenings. Overall, in the West, early diagnosis and individualized treatments are important for achieving glycemic control, reducing long-term complications, morbidity and mortality, and improving overall patient outcomes. In Tibetan medicine, diabetes is commonly associated with a condition called Chinyi-zaku, which is often associated with disturbances in digestion, excessive dietary intake, emotional imbalance, and weakened internal harmony. Diabetes is viewed more holistically as an imbalance involving the body, mind, emotions, digestion, and lifestyle, as health is based on a balance between three primary energies, lung, tipa, and bacon. Rather than focusing only on the blood sugar levels, it's more of a holistic and balanced perspective. For pathogenesis, Tibetan medicine views diabetes as developing gradually through long-term imbalances caused by excessive intake of rich, sweet, oily, or heavy foods, sedentary lifestyle, emotional disturbances such as distress, attachment, and mental dissatisfaction, and weakening of digestive and metabolic fire, causing an increase of bacon in the blood. These factors disrupt digestion and nutrient processing, leading to accumulation of excessive fats, fluids, and metabolic waste within the body. Over time, this imbalance affects circulation, organ function, and energy regulation, which parallels the progression of metabolic diseases seen in Western medicine. Diagnosis in Tibetan medicine is highly individualized and focused on identifying the root energetic imbalance rather than only elevated blood glucose. Traditional diagnostic methods include pulse analysis, urine examination, and observation of physical symptoms, digestion, sleep, emotional state, and lifestyle patterns. Practitioners assess which of the three energies is most disturbed and evaluate the patient's overall constitutional balance. The treatment aims to restore balance and improve overall well-being rather than only lowering glucose levels. Common approaches include personalized dietary recommendations, behavioral and lifestyle modification, herbal formulations, meditation and stress reducing practices, and physical activity and digestive support. Meditation is considered important because mental and emotional imbalances are believed to contribute to disease progression. Tibetan practices emphasize calming the mind, improving awareness, and supporting emotional regulation. Prevention in Tibetan medicine focuses on maintaining harmony between body, mind, spirit, diet, and environment. These include eating according to one's constitution, avoiding overeating and excessive sweet or fatty foods, maintaining regular physical activity, and I think it's 150 minutes per week at the minimum for physical activity, managing stress and emotional imbalance, practicing mindfulness and meditation, and preserving digestive heat or bacon, and balance in daily routines. The overall goal is to prevent energetic imbalance before disease can manifest physically as a preventative measure. In 2001, a pilot study evaluated Tibetan medicine here at Men-Tsee-Khang using clinical research framework familiar to Western medicine. It laid the foundation to other Tibetan medicine studies, and the findings suggested that Tibetan medicine may provide supportive benefits when combined with conventional diabetes management. It is important to emphasize that current evidence supports Tibetan medicine primarily as a complementary approach rather than a standalone treatment for diabetes. But Western medicines like insulin and metformin are reduced after Tibetan medicine has been introduced. For comparative perspectives, Western medicine primarily targets the biological mechanisms of diabetes and complication prevention through measurable clinical outcomes. Tibetan medicine approaches diabetes as a systematic imbalance involving physical, emotional, mental, and spiritual health. Together, these two perspectives highlight two complementary approaches, one on the biomedical management and disease control, and the other focused on holistic balance, prevention, and overall well-being. An integrative approach may offer opportunities to improve both metabolic outcomes and patient quality of life while maintaining evidence-based medical care. And some modern studies also suggest that Tibetan medicine may provide benefit as an adjunct to conventional therapy in type 2 diabetes management, particularly in improving quality of life and supporting holistic care. There's also a National World Diabetes Day, which is November 14th. So if you know anybody who's diabetic, make sure you let them know on that day. But I think that's all I have. Tichana. Thank you.